Welcome back. According to the American Medical Association, nearly half of all patients in the U.S. don't understand health information they're given. And medication labels, in particular, can be very confusing. We're talking with Lisa Sather this morning to help us translate some of what we find on our medications. Thanks for sticking around with us, Lisa. So let's keep looking at those medication labels. Warnings are often on there. Are there some common warnings on medication labels that folks should pay particular attention to?
Sure, Beth. Yeah, sometimes you'll see the actual warnings actually printed right on the label, and sometimes you'll see what we call auxiliary stickers stuck to the label of a medicine. And that's really important for patients to pay specific attention to because they are important, they are valid. Your pharmacist should be talking to you about those when you receive a prescription. But some of the most common ones would be do not drink alcoholic beverages, or may cause drowsiness or dizziness, take with food. We kind of hit on that earlier. So there are also maybe there's just a whole host of warnings. You may also receive some additional printed information with the prescription that really goes into detail about specific side effects and things to look for. So that additional printed information is always good to refer to.
Okay, great. And so studies have shown that sometimes those warnings can be misunderstood, especially if they use words that folks might not understand or if there are multiple steps to the warnings. Can you talk a little bit about some of the issues people might have in interpreting what's on those warning labels?
Sure, that's a great question. So like you mentioned, some of the warning stickers might just have symbols. They usually have wording with it, but if someone just kind of reads quickly through the wording and just picks up a few words, they might interpret something that says do not chew or crush, swallow whole to mean do not swallow whole, which really isn't the whole story. So there are also warning labels that might have may cause drowsiness, but it has a picture of an eye on it. So that doesn't mean the medicine goes in your eye. That means it might make you drowsy. Right. So it is important to talk to your pharmacist about that. If you have any questions whatsoever, sometimes the color of the label can be confusing because if it's red, it might mean stop. If it's go, it might mean everything's okay. So there's just a whole host of warning labels. I brought just kind of a picture to show you, kind of the differences of what all of these look like, and they can be used just for different reasons on different medicines. So it's important to look at.
So what advice would you give to folks then to make sure that they're paying attention to those warnings and that they really understand the message they're trying to get across?
Sure, it's really important to talk to your pharmacist about every prescription, talk to your doctor about every prescription. Anytime you receive a new prescription, it's important to go over all the information to make sure that you understand all of that. If you have any questions whatsoever, feel free to speak up. You're in charge of your health care, so that's really important to remember.
Okay, good advice. So what about storing your medications? Are there certain ways that medications should be put away, or are there certain places that we should be keeping our medications?
Sure, great question. So heat, light, air, and moisture, of course, can break down medicines faster than usual, so it's important to store them in a cool, dry place. Oftentimes people think about putting them in their medicine cabinets, but obviously that's in a bathroom, and there can be moisture and heat in there, so that's not necessarily the right place to put them. In a cupboard, in a drawer might be an okay spot. Of course, if it's a controlled substance, something that has a high potential for abuse, a narcotic, a pain medicine, some of those kinds of things, they should be in a locked cabinet. That's really important information to know, so people should keep that in mind.
Okay. How can you tell if a medication has gone bad or it's damaged in some way? What should you look for?
Sure. Well, first, it's important to note that every one of your prescriptions will have an expiration date on the label. So that's first and foremost. But aside from that, if your medicine starts to smell differently or look differently, or if you look into the bottle and the tablets are somewhat broken up or stuck together, that's an important situation to pay attention to. Certainly, you could check with your pharmacist, but it might be time to discard that medicine even if it isn't past the expiration date on the label.
Okay. So we've talked a lot about the labels and instructions that might come with medications, either prescription or even over-the-counter has those too. When is the right time to read all of that?
Right, the quick and easy answer is before you take the medicine. Of course, it's important to read every label anytime you get an over-the-counter medicine or a prescription medicine, and you want to make sure you understand all of the information about it before you actually take the medication.
Okay, so let's just walk through that process a little bit. Ideally, if somebody is at the doctor's office and they've been prescribed a new medication, what should they do before they even walk out of that doctor's office?
Sure, make sure you understand why the medicine is being prescribed. What are the risks associated with it? How should you be taking it? How long should you be taking it? What side effects are there that you should be looking for? Make sure you talk to your doctor about any other medicines that you're taking, even if it includes over-the-counter medicines. So it's important to go through that with your doctor first and foremost, and get any questions you might have answered initially there with your physician.
Okay, perfect. So you've asked your physician those questions. Now you're going to go and pick up your prescription. Are there things that you should specifically talk to your pharmacist about?
Right, so this kind of is along the same vein as talking with your physician. In fact, your pharmacist is really the drug expert. They should be taking the time to counsel you on your new prescription. And what I like to do, and when I'm counseling a patient, is actually open the bottle, show the medicine to the patient, ask them what their doctor told them about their medicine, how were they told to take it, so we can kind of confirm that everything is on the same page. But they're really there to reiterate and help you with any of the questions or concerns you have as well when you receive a prescription.
Okay, great. I think we have time to squeeze one more question in here really quickly. We're going to talk more about this after the break anyway, but once you get home then, any general tips for either getting yourself organized or just making sure that you have your medication where you need it?
Sure, it's important to keep an up-to-date medication list at home. So if you receive a new prescription, make sure you include that, put it on your list. If you have a pill organizer, you can add it to the pill organizer. Whatever method you use, it's just important to keep all of that up to date and be consistent with that.
Okay, perfect. Thank you, Lisa. We do need to stop for another break, but coming up next, do you have multiple medications and have trouble keeping track of them all? We'll talk about how to stay organized and much more right after this. Don't go away.